Thank you so much, Peeperkorn, for your briefing. We commend you for your courage and your straightforward briefing and honesty. I have a question. I mean, the Prime Minister of Israel said in the General Assembly, there is no famine in Gaza. So as an eyewitness, how you can respond to that from your experience? And if you can share with us some of the little talks you have with mothers who are seeing their children dying of famine, and how do they cope with these tragedies? Thank you.
Yes, of course. The official answer I could give you, you have been briefed, I think, extensively about the IPC reports. And this, so I'm a simple medical doctor and a public health expert, but those are a whole group of experts on these areas. And we have had various IPC reports over the last year. And and I even remember very vividly in January, February 24, we also had for a while a blockade of the north. Maybe you recall that. And also we had a lot of, then the food supplies very quickly dwindled, prices went up very dramatically. And we saw, of course, also looting, from the few nutrition supplies which went up north. WHO was supporting that some therapeutic feeding centers in the north, for example, in Kamal one hospital, and patient-friendly hospital, and they visit them very often. And even then, you saw trends of very quickly increasing trends of children which were moderately malnourished, and a smaller group were severely acutely malnourished. So that was already, and we made the point then already in Gaza, before this crisis, there was no child malnutrition. You talked about 0.6, 0.5% for the children which were malnourished. So it was never an issue. I remember also health workers struggled to cope with that because they didn't know how to deal with that. We had to do this kind of specific training, etc., etc. Even then, I met so often desperate mothers and children, which, if you first would have a look, you would say they're 2 years, etc., and they were actually 4 or 5 years old, etc. Desperate mothers which didn't know how to manage and what to do. Now then, and this is the problem, like the food supplies, everybody talked about food. What, of course, definitely everybody needs is diverse foods. A proper diverse food, and that always has been the problem, I think, since this crisis. Way too little diverse food have come into Gaza. Now, over the last year, we saw again, and specifically again with the blockade, we saw very quickly rising malnutrition rates. It was, I think, in July, and let me say, it was suddenly what do we talk, 40,000 children which were assessed as malnourished. Yeah, and so I've seen also personally too many in all this, what you call severe acute malnutrition centers, therapeutic feeding centers, etc. Too many children, which were clearly very much malnourished. And I ask sometimes, talking to the families, like when did it start and how did it start and what could you do, and the lethargy. I mean, of course, it's always the most vulnerable groups, often female-headed households, etc., the more vulnerable families where this also happens. What we saw also of late in the last year, we saw also a lot of pregnant and lactating women, which were malnourished. If you talk to the physicians and medical specialists in hospitals, and I've seen so many patients, I mean, severe trauma patients, etc. They even said even the simple trauma ones, that their they didn't recover that quickly, because almost all of them had a level of malnutrition. And so they say the whole recovery process actually was very much extended. Wound infections were, of course, also a huge problem. So, yeah, we have seen too much of this, and people ask me now as well, oh, but now there's a little bit more food. Is this now going better, etc.? Just want to remind everyone, first of all, yeah, there's a bit more food. That's definitely true. Prices are still way too high for many of the families. Food is still not diverse enough. But of course, if you have a number of specifically the vulnerable groups, and the vulnerable groups in IPC report were very much marked children under 5, but the IPC report also referred to older children and elderly. Now this in a combination with horrific water and sanitary conditions and all of is only exacerbating that whole process. So this will also take a long time, a really long time to restore. And I think some of the affections will be permanent. Over to you.
Ibtisam.
Thank you. Hi, my name is Ibtisam Azim, Al Arabi Al Jadid newspaper. I have first a follow-up question